I'm Dr. Suresh. We have met before. I'm Medical Director and Chief Internal Medicine and Cardiology at Pacific International Hospital. My colleague Dr. Kohli spoke to you sometime back about ear, nose and throat infections. Today we go a bit down towards our chest cavity and how these infections can go into chest infections and create major medical issues. The common chest infections are actually just two: bronchitis and pneumonia, which means that the infection going down from your ear, nose or throat gets into your airways, and that is bronchitis. When you get cough, production of sputum and chest pain and possibly a fever and some difficulty in breathing. When that travels still further, then the real trouble starts. Infection gets into your lungs, your right and left, and that leads to pneumonias. Pneumonias are unpredictable. They need early diagnosis, early treatment and quick recovery. If not, they go into several well-known complications. Normally, a fairly healthy person can get over a bronchitis and pneumonia. Their immune systems fight for them. Doctors begin antibiotics. A few days of rest, you are back to normal. But they are. In people who are weaker, who are compromised, who have other infections, who have heart and kidney problems, who have diabetes, who have HIV/AIDS, yes, they can become killers. So they can go out of control and imperil and threaten life. At that point, you require more help beyond a doctor's tablets or a few injections. You need to be in an intensive care unit, and pneumonia is going out of control is what we call the ARDS, Adult Respiratory Distress Syndrome. It's a killer in all parts of the world, and you require an intensive care unit to survive those 2 or 3 weeks of intense physical disease and its crises. We are happy to say that we are the only intensive care unit in the entire country which can take care of an adult respiratory distress syndrome. It needs a full team, full instrumentation, full backup, variety of new antibiotics, and very, very careful, meticulous treatment. Practically for any common cold, a home remedy is equally good, because you have heard the old expression that you treat a cold or don't treat, it will still take 7 days. It's okay. So home remedies are useful, they're economical, they are reassuring for common garden problems. But when you feel that things are not going well, when your GP feels that things are not going well, it is high time you consult a more experienced colleague who has a more elaborate medical infrastructure behind him or her to ensure that you will be safe. So you take the call, your GP takes a call to decide when home care is not good enough and when to seek expert help. If you postpone that too long, it may lead to certain unforeseen problems.